Hey, today is March 2nd, and the reason I'm telling the date is as of right now, our news is pretty dominated by this COVID-19 or coronavirus that seems to be striking everybody in every country in the world. And I don't think there's going to be a lot of exceptions. I think this is going to be a problem globally for hopefully just a few more months, but you never know how long a epidemic or pandemic is going to last, and we don't really know what the effects are. So it is natural to be afraid of something that is unknown. And I don't think there's anybody who doesn't have at least a little bit of concern. And there are many normal human beings who are just going to be frightened by this. So let's accept and understand that we're going to be a little bit scared. I am too, just to a degree. But after we get past the fear, what can we do about it? Well, we know we can't control where a virus is going to float around, but we can control a couple of things for ourselves to minimize our chances of getting it and maximize our chances of recovering from it if it does happen. So, first and foremost, common sense: wash your hands frequently. We're all guilty of not washing our hands enough. We don't have to be insane germaphobes about it, but wash your hands frequently for about 20 seconds with a lot of rubbing and a lot of rinsing and a lot of water and soap, preferably an antibacterial soap. That is the most effective way to control the spread of disease anytime. You saw me a moment ago touch my face. I had a little itch on my nose. Well, we got to stop doing that because germs enter the body not through the skin, but through the pink stuff that is inside of our nose and inside of our mouths. So we want to avoid touching our faces, rubbing our eyes. Gloves, if you can get some gloves and use them when you're pumping gas or even grabbing a supermarket cart, do that. Otherwise, take some disinfectant wipes with you and wipe things down. Anytime your hand comes in contact with something, you're going to have a chance of contracting a germ that's on that surface. We may consider stopping shaking hands and doing just a fist bump or an elbow tap because, again, hand to hand contact can spread uh, germs or viruses. Coughing and sneezing. Very, very important that you either cough into a tissue or into the elbow of your clothing. Do not cough in your hands. My mother taught me to cover my mouth when I cough. Well, the rules of the game have changed a little bit because you don't want to cough the germs onto your hands and spread it. Cough here, but of course the germs will be on your clothing, or cough into a tissue and dispose of it. Here's where things get interesting. Your immune system is a critical part of your natural defense. Now, I do not have any CDC information on this. I do not have any official data on this. Take it from an experienced professional, even though there's not a ton of research in this arena yet. But think this one through. You're going to need your immune system at its max to combat anything that invades your body. If your gums are bleeding, if your gums are inflamed, then your immune system is going to be diverted to combat the inflammation, the avoidable inflammation. Whoops, touch my face again. Don't do that. But your immune system will be called to combat preventable inflammation that's in your gums, and there will be less of your immune system available if, heaven forbid, you are invaded by something like a COVID-19 or a flu virus or anything else. So it behooves you to floss your teeth every single day. And do visit your dentist to get your teeth cleaned 2, 3, 4 times a year, whatever they all recommend is appropriate for your situation. Very, very important to keep your immune system strong and to prevent the insult of the preventable inflammation that is gingivitis from distracting your immune system. I hope that helps you a little bit. There's no need to panic. There is need to start thinking before we start touching stuff. And there is need to think about maintaining our bodies as healthy and strong as possible, especially during a time where there's a lot of nasty bugs in the air. So we're all going to get through this. Everything is going to be fine. Most of us are going to be okay. And if you are immunocompromised, please talk to your physician about what precautions you can take. And of course, if you're not feeling well, stay home. My team is instructed to stay home if they're not feeling well. We don't want to be bringing these germs in here. So there are a couple of my thoughts on this COVID-19. Let us all get through this together. Let's all be together in health and prosperity for a long time. Hand cleanliness, don't touch your face, wipe down any surfaces, and please be careful. And don't forget to live and love and care for everybody around you. Be healthy, folks. We're going to get through this. And I'm here to answer your questions if you need them. Be healthy.